All right, so my presentation today is on kidney disease. What exactly is kidney disease? It is characterized by kidney damage evidenced by microalbuminuria or reduced kidney function as indicated by a glomerular filtration rate or GFR of less than 60 milliliters per minute for at least 3 months. Chronic kidney disease is categorized into 5 different stages, which are all based on GFR and the amount of albumin present in the urine. So I have those 5 stages listed below. There's really 6 because stage 3 is broken up into 2 separate stages, G3A and G3B. But as you go down the list, the kidney disease becomes more severe. So at the top is your least severe stage, where you really don't even have chronic kidney disease. As you get to G5, that's where we see kidney failure, and you're approaching the need for renal replacement therapy such as dialysis or a transplant. In the US, more than 20 million adults have chronic kidney disease, and hypertension, diabetes mellitus, and CVD are very common in the chronic kidney disease population, with prevalence of comorbidities increasing from G1 to G5. Some special considerations for exercise testing. So, medical clearance should be obtained before exercise testing occurs. However, exercise testing may be indicated as part of the actual medical clearance process prior to the beginning of an exercise program for individuals with CKD who also exhibit symptoms of CVD or are candidates for kidney transplantation. So, this does not apply for all CKD patients, but specifically those who have, say, CKD and also are exhibiting symptoms of CVD or could potentially be a candidate for a kidney transplant. The exercise professional should be aware of all medications that the patient is taking, such as those commonly used in the treatment of hypertension and dyslipidemia. When performing an exercise test on individuals with category 1 through 4 CKD, standard procedures should be followed. Patients receiving hemodialysis should only test on non-dialysis days, and blood pressure should be monitored in the arm without the arteriovenous fistula. And again, those patients who are on hemodialysis are likely going to be in stage 5 of CKD. Standard procedures are used for transplant recipient patients. We have some more special considerations for exercise testing. The treadmill and the cycle leg ergometry procedures can be used to test individuals with CKD. However, more conservative protocols should be used due to the low functional capacity of this population. So you can use the treadmill and the cycle leg ergometer, but you're going to have to use a more conservative protocol compared to that of a healthy individual that you might be testing. Heart rate is not always the most reliable measure of exercise intensity for patients with CKD. Because of this, RPE should always be monitored. Physical performance tests for muscular strength, balance, and flexibility, which are often used for older adults, may be beneficial for this population because of their low functional capacity, even if the patient you're treating is not an older adult themselves. 1 repetition maximum isotonic strength testing is contraindicated for patients with CKD because of the heightened risk of spontaneous avulsion fractures. And lastly, muscular power should be assessed using a computerized dynamometer, as it appears to be more related to functional ability than either muscular strength or endurance. Special considerations for exercise training. So some individuals with CKD may be unable to do continuous exercise and therefore should perform intermittent exercise with intervals as short as 3 minutes interspersed with 3 minutes of rest. So essentially, you want to shoot for a 1-to-1 work to rest ratio. As the individual adapts to training, the work interval can be increased though, while the rest interval decreases. Initially, a total exercise time of 15 minutes can be used. This can be increased though within tolerance up to 20 to 60 minutes. If a medical setback occurs, the exercise progression may need to be slowed down. And the duration of physical activity should be increased weekly by 3 to 5 minute increments until the individual can complete the 30 minutes of continuous activity before increasing the intensity. So essentially, you want your patient to be able to exercise continuously for 30 minutes before you even touch the intensity. The intensity is going to stay the same until we reach that point, and then we can start to increase the intensity from there. Our fit recommendations, first for aerobic training. We want to train aerobically 3 to 5 days a week at a moderate intensity. So that would be about 40 to 59% of VO2 reserve, or an RPE of 12 to 13 on a scale of 6 to 20. For our time, we're going 20 to 60 minutes of continuous activity. However, as I mentioned, if this cannot be tolerated, we want to use 3 to 5 minute bouts of intermittent exercise, aiming to accumulate 20 to 60 minutes per day. And for our type, we want prolonged rhythmic activities using large muscle groups. So these could be activities such as walking, cycling, or swimming. For resistance training, we want to shoot for 2 to 3 days a week. Our intensity needs to be 65 to 75% of 1 rep max. But as I mentioned, the performance of 1 rep max is not recommended for this population. Because of that, during exercise testing, either the 3 rep max or a higher rep max test needs to be conducted in order for the 1 rep max to be estimated from that test procedure. Once the 1 rep max is estimated, then you can have accurate percentages for your patient to work off of. For the time, we want a minimum of 1 set of 10 to 15 repetitions. However, the goal in most patients is to achieve multiple sets. You also want to choose 8 to 10 different exercises targeting the major muscle groups. And for our type, you can really do just about anything: machines, free weights, or bands. For flexibility training, we want to complete our flexibility training 2 to 3 days a week. For our intensity, for static stretching, we want to stretch to the point of tightness or slight discomfort but not pain. And then for PNF, we're looking for 20 to 75% of maximum voluntary contraction. For the time, we want 60 seconds per joint for static stretching, so that would be 10 to 30 second holds per stretch, or 3 to 6 second contraction followed by 10 to 30 second assisted stretch for PNF. And again, the types would be static or PNF. Some special considerations for kidney disease. So these that I'm about to discuss are specifically for patients who are on hemodialysis. These patients should ideally not exercise on dialysis days. We want to avoid that if possible. When performing exercise immediately post-dialysis, the increase of a hypotensive response is also increased. During any aerobic exercise, it may be beneficial to use RPE to guide exercise intensity because heart rate can be unreliable. Patients may exercise with the permanent arteriovenous access. However, placing weight or pressure on the device should always be avoided. Blood pressure should be measured in the arm without the fistula. And if exercise is performed during dialysis, it should typically be done during the first half of treatment to avoid hypotensive episodes. So, as I mentioned, ideally we want to perform exercise on non-dialysis days. However, if for whatever reason that isn't possible, it is okay to exercise during dialysis as long as you're exercising during the right portion so that we're avoiding any hypotensive responses. Exercise modes used during dialysis are pedaling and stepping devices, which can be used while seated, and the patient should not exercise the arm with the permanent arteriovenous access during dialysis. For patients who are on peritoneal dialysis, patients on continuous ambulatory peritoneal dialysis may attempt exercising with fluid in their abdomen. However, if this produces discomfort, then they should be encouraged to drain the fluid before continuation of exercise. And lastly, for recipients of kidney transplants, during periods of rejection, the intensity of exercise should be reduced, but exercise can still be continued. And that concludes my presentation.